One of the technical pieces of this is how this all works. So there's different systems. There's something called a RAPS, Risk Adjustment Processing System, and an EDS, which is an Encounter Data Processing System. So this is a very technical piece Ford and myself specialize in, and we're able to help your teams with. And when it comes to the risk adjustment score calculation that we talked about, there's two components. Number one, providers must document appropriately and their offices must submit claims appropriately. But we know everybody's not perfect. So we have review teams that are able to review and submit claims that were missed and also let you know of what was documented inappropriately that will get deleted by CMS. So we will take all of this data, we'll review it, we'll send it to the health plans with your consent, of course, and help the processing take place. And the health plan will process the claims and submit the RAPS and EDS to CMS. CMS will take these different encounter data points and process all of the information, and they'll add patient demographics. So as we know, a 78-year-old male may be sicker than a 60-year-old male. So they will factor in demographics. They'll also factor in zip code. If it's an underserved area, there will be a couple of points added to the risk scoring as well. And that will lead to a risk score, which is one point something, and that tells you the future care and resource needs of each patient, which equals a dollar amount. So this process takes place throughout the year. But one thing to understand is when it comes to the calculation or the MRA calendar, the way this works is risk score that you're looking at that you get for your patients from your health plan partners today is work that was done 12 to 18 months ago. So there are deadlines that CMS has, and July to December, those date of services would be due for July to December. The score would not be manifested until June of 22 usually. So that's almost a year and a half after the date of service that the score gets updated. So some things to keep in mind: if a patient passes away and they're really sick, you may never see the financial compensation that is due, because if a patient dies by June of 22, then of course there will be no financial compensation. So something to think about. It's very important to make sure that you see the patients early in the year, because if you see them in January and February and make sure you bill appropriately and that gets in before the June sweeps, then at least you know the reimbursement will be due within a year. So you will see that payment for that patient's sickness within a year. So it's very important to see your patients often and frequently, but of course, all Medicare Advantage patients, I strongly urge you to see them in the first 6 months of the year, but really in the first month of the year. If you can get them all in earlier, get your billing done, get your notes done, make sure you evaluate them for disease, then you will definitely see the payment in 12 months. But if you see them in July or August, there's a chance you don't see it until the following January. So not if it's August, like let's say you see a patient today, it's October 31st, 22. You may not see that payment until January of 23. That's a long time. So it's very important to make sure you see your patients frequently and make sure you submit your claims as soon as possible and make sure your documentation is supporting.